everybody, and welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. So today my topic is a very interesting topic which was posted by one of my followers. I'm going to read out the questions to you. After giving birth vaginally on my second child, she described it as my ovary seems to have wind inside all the time. It will fart unfinished winds out when I'm in doggy position. It disturbs the intercourse as it becomes painful when penetration happens. How to overcome this and what are the causes? So very often I get questions like this, things that happen to women after a certain childbirth. After some childbirth, something happened that is no longer the same as before they gave birth. There are some women who, like in this case, she complained about farting during sex, uncontrolled, continuous farting, multiple times of farting, passing out gas, which is farting during sex, when only she's in the doggy position. There are some women also will tell me that they feel like gas coming out from their vagina every time they just suddenly sit down. They will feel like gas coming out of their vagina. And they don't know what's wrong. And I can understand in this lady that it is actually quite embarrassing, right? I mean, some of us may fart once or twice during intercourse. I think that's very normal, and that is part and parcel of our daily thing. It's just that so happen we want to fart during that time. But when you get it again and again at the same time, and it's multiple farts during sex, only in doggy position, that is not really normal. And why is that so? This has all got to do with pelvic organ prolapse. If you look at my previous videos, I have talked about uterus prolapse. I've talked about uterus prolapse, incontinence, and this has got to do with some form of pelvic floor weakness that cause prolapse, or in a way, gas incontinence. It's not urine incontinence, but it's gas incontinence because you are passing out gas through your butthole and you're unable to control it. So let's go back to what happens during childbirth. During pregnancy, when the baby compresses onto our pelvic floor, there's a lot of weakening of the pelvic floor that happens during childbirth. And then during pregnancy itself, number one, because of our relaxin hormone that causes everything to relax, to soften. So our pelvic floor actually also loosen during pregnancy. It needs to loosen to be able to expand further for the baby to come out. This is part and parcel of pregnancy. And then during childbirth, when we are trying to push the baby out, sometimes we actually get injury to the muscles of the pelvic floor. When you get injuries to the muscle of the pelvic floor, then some of these muscles that are deep-seated inside, you don't even see the injury. The muscle tear, but you can't see it. You see the tear outside, actually, the one that we stitch, the episiotomy or whatever wound that you create during a childbirth that we stitch is what we can see, and it's usually very much outside. But you can have muscle tear inside. You can also have sphincter tear inside. You can actually accidentally tear your anal sphincter. What is anal sphincter? Anal sphincter is the sphincter that control not to let gas come out and not to let all your feces come out. So we can control. Some women, even after pregnancy or childbirth, they also find that even want to go toilet to poo, they find it very difficult to control. It tends to have a tendency of coming out if the urge is too strong. That's because there is pelvic floor weakness. At the same time, there's also weakness of the sphincter. The sphincter is the door. I always say the door that controls the outlet, that makes sure it doesn't leak anything out. So when your sphincter is injured or your sphincter tear during your childbirth and you didn't know and didn't get it repaired, or even if you got it repaired, but sometimes not all wounds heal well. So even if you repair, it may not heal well. So what happens is it becomes loose and it can leak things. It can leak your poo, or we call feces. It can also leak gas, like in this case. But why is it that she only get it during sex and not other time? Or is it only during sex that is troubling her? Maybe other times she's fine with it. You know, it's normal to fart in front of people or not in front of people. On our normal day-to-day, everyone farts, right? But why does it trouble her during sex, and it only happens during the doggy position? So what I want to explain to you is something that I have a diagram here to show you. You look at this diagram, this is exactly what the parts of our body when we have doggy position, which means up here is the back and this is the front. So you have your bladder, your vagina, that's where you have sex, and that is your bowel here. That's where all your gas and everything is. When you have sex in doggy position, you are slightly like this, the position, and we know that the penis will be headed upward. So it actually hits on the bowel position. And if your sphincter, which is the outlet, is weak, then it has a tendency of leaking gas. In fact, it can leak anything. But gas is probably the easiest thing to come out, because when you have something pushing in, the first thing that easier to come out would still be gas. But there's another condition that can happen after childbirth that is also linked to pelvic organ weakness, is what we call rectocele. So what happens in rectocele is the bowel bulge into the vagina. The bowel bulge into the vagina, which is a kind of prolapse. We can have uterus prolapse, you can have bladder prolapse, you can also have rectal prolapse. Rectal is the last part of the bowel that bulges here, and when it prolapses, it will come out through the vagina area. So when you have sex and you push in, when the position is doggy, you actually push it in this way. So when you push in this way, you directly compress on the bowel, and so the gas leak. So that is exactly what happened to this particular patient who asked this question to me. What she has is either just a rectocele, just an anal sphincter weakness, or a rectocele plus an anal sphincter weakness. Because if we have a rectocele, but if our anal sphincter is very strong, it shouldn't leak that easily. We should be able to still hold it back. But if your anal sphincter is loose, so when you push on this entire bulge, the gas will leak. So, as I say, it can be just due to anal sphincter weakness or anal sphincter weakness in combination with rectocele. So, it's back to pelvic organ prolapse. In general, we call this whole thing as pelvic organ prolapse. So previously, I did talk about uterus prolapse. So if you want to know more about uterus prolapse, please go and look at my video. So you can have uterus prolapse. In pelvic organ prolapse, you can have uterus prolapse. You can have bladder prolapse. You can have the bowel rectal prolapse, which is the bowel prolapsing into the vagina. You can have the bladder, this is the urine bladder. You can have the bladder prolapse into the vagina. You can have the uterus coming all the way down. Or in this small area, some other small bowel can also come out into the vagina. So we have rectocele, which is a rectum prolapse into the vagina. Cystocele, which is the bladder prolapse into the vagina. You can have uterus prolapse, or you can have anthrocele. Anthrocele is the small bowel that prolapse into the vagina. See, so many things can prolapse into the vagina. Because vagina is a very big hole, anything can come out through it. It's like a hernia. Anything can come out through it. And whichever thing that come out, it gives you a different symptom. So if you fart during sexual intercourse, and if it happens again and again and again and again, then you have to think about anal sphincter weakness or due to rectocele plus anal sphincter weakness. So that you still need the anal sphincter weakness. So in childbirth, we can actually tear our anal sphincter, because you must understand our anus is just below the vagina. So this is the vagina hole, and you have the anal sphincter here. So you can have wound that goes straight down and tear the anal sphincter. Sometimes you can see that the anal sphincter is torn because the skin and everything around it is torn, so we can see it. But sometimes it can be torn deep inside and you don't see it because the wound outside it is not torn. So you actually don't see it. So when you don't see it, you don't repair. But if you see it and then you repair, even if you repair, it also depends on how well your wound heal. We know with childbirth, sometimes the wound don't heal so well because the wound can get infected easily. And as a result, if the wound don't heal so well, there will be anal sphincter weakness. How to tell that? How to know whether you have prolapse rectocele or you have anal sphincter weakness? One of the way, of course, is to see your gynae and get an examination done. Because when we examine you vaginally, we can tell whether there's a rectocele. Rectocele is usually very easily detected, very easy to see. But for anal sphincter injury, we may not be able to see it just by examining you. But what we can do is to do a perineal ultrasound. In a perineal ultrasound, we can actually see whether the anal sphincter is intact. And this is one routine ultrasound that I do for all my postnatal mothers. I started this practice about 10 years back. We decided to do it for all. It is not a routine by everyone. 10 years back, I decided to do that is because we started teaching pelvic floor exercise. Because if we detect pelvic floor weakness in a perineal ultrasound after your delivery, so in a postnatal visit in my clinic, I usually routinely do a perineal ultrasound. A perineal ultrasound is the ultrasound just the same like you scan your tummy, right? But now I scan from below, but I put it outside. I don't insert inside. I actually put the same ultrasound probe that I use for your tummy, but now I put it below you, just at your vagina, and then I will scan and see the pelvic floor, whether it's weakened, your anal sphincter, whether it's intact. So because when we see it, we can actually send you to the physiotherapist to do pelvic floor exercises and pelvic floor strengthening. So the main thing you need to do, first thing you need to do when you detect this, if you want to solve this problem, we still go back to physiotherapy first. So in physiotherapy, what my physiotherapist will teach you is basically pelvic floor exercise. There are many things you can do with pelvic floor exercise. You can also increase the intensity over time if you're hardworking enough to keep coming back to see my physiotherapist. So you can always increase back increase your muscle strength. You know, pelvic floor exercise, I always describe it like weightlifting. When you lift weight, you always lift with the lightest weight, but over time you increase the weight heavier and heavier and heavier. So basically we increase the intensity of the exercise, so we strengthen the muscle further. Even in pelvic floor exercise, there are ways where we can increase the muscle strength of the pelvic floor, and that will help you solve this problem. But just in case it doesn't help, there are two situations. One is no matter what you do, you still feel that it's not helping, then of course the last situation is to do a surgery to repair either a rectocele if you have one, to repair your sphincter if you have sphincter weakness. Their second situation, we give them pelvic floor exercise. You know lah, we all exercise. Don't say pelvic floor exercise, any exercise also. A lot of us are very lazy. We learn, we do a bit, and then we don't want to do already. Or we find so troublesome to go and do an exercise every day. Do how many times, how many minutes. So lazy to do. So there are women who will opt for surgery right from the start. Okay? So you can either be doing a surgery or you do pelvic floor exercise. But generally, we feel that you should be doing pelvic floor exercise first, because in most situations, especially young women who have just given birth, pelvic floor exercise is actually very effective. And if you're hardworking enough to do it, we are just talking about a matter of weeks, you should be good. You should be back to normal. But if you have but if you're so lazy to do it, like all exercise, even if you do it, you need to maintain, and you're so lazy to maintain and the problem still comes back, then of course surgery is the other option. Surgery for rectocele, we can either just repair the rectocele, we can either push it up or pull it up. So just like in my pelvic organ prolapse, I did describe on types of surgery. There are just so many types of surgery for pelvic organ prolapse. We can either use the push-up technique or the pull-up technique. Normally we say the pull-up is still more long-lasting, but if it's not very bad, sometimes just a push-up, which is a much smaller surgery, will be enough already. But sphincter repair is also something possible. But normally in this situation, sphincter repair, we usually pass it to the colorectal surgeon and not done by gynae. But for rectocele repair, it's usually still done by gynae. So this is all I need to say about today's topic, short and sweet and simple. Even in other situations where some women complain about gas coming out through the vagina after they give birth, it is also the same reason. It's all due to pelvic floor weakness, and the solution is also the same. But when you see a physiotherapist, you need to explain that your symptom is actually more from the bowel problem, so that they do a different exercise. Because pelvic floor exercise, we got front compartment, middle compartment and back compartment exercise, which is different, and these things are usually done by physiotherapists that specialize in pelvic floor. Actually, physiotherapists got all kinds one. There's some who do more on women health. When they do more on women health, they are very much more experienced in pelvic floor exercise. So one I have in my clinic, I have a physiotherapist in my clinic that does nothing but women health. So that's why that is one place that I really, my clinic is somewhere I would advise to go, and I do see very good results from my physiotherapist. Her second part of the question, because she finds it very painful. Now she finds sex very painful. It disturbs the intercourse as it becomes painful when penetration happens. Why do you think it becomes painful? Think about it. When you have prolapse, you shouldn't have more pain, because when you have pelvic organ prolapse or pelvic floor weakness, everything is actually looser already. So when it's looser, then it should not have any pain, right? So what is happening now is all like, if you remember the talk I gave on painful sex. Why do women get painful sex? The commonest reason for painful sex is up there, psychological. Why? Because when we are not into sex, when we're not into sex, when we don't have like all the mood and everything, you won't be able to get your vagina to lubricate nicely. It will not lubricate nicely. You want to lubricate nicely, you all have to be, all your mood, your hormone, all the right hormone must come out. But can you imagine if you have this problem, this farting during sex, and you know it's going to happen? Do you think you'll be like all in the mood when you're having the sex? Or you're just so worried that it will happen again and you will embarrass yourself? So when you have sex, you're very stressed. When you're stressed during sex, the lubrication will not be complete, and as a result, it will be painful. So painful sex, very often it is due to psychological stress. So if you're stressful during sex, that is when you will find that sex will be painful. So that explains her second question. Vivian asked, how does prolapse happen usually? I think I explained just now. It very much due to pregnancy and childbirth. So this is one of the things that women have to face and have to go through when you have pregnancy and childbirth. So that's why very important, we should do some form of postnatal assessment if possible. Well, you have one way. One is just everybody do pelvic floor exercise. If you have natural birth, just do the pelvic floor exercise, which is something I normally encourage, because in my antenatal class, that's what we teach all our women or my mothers, that is 1 week after childbirth, you should start doing all your pelvic floor exercises. So another way is in your postnatal checkup, which is what I routinely do after 2 months of childbirth. I usually do a perineal scan to look at the pelvic floor. Basically, I do pelvic floor ultrasound scan, which is a transperineal ultrasound. So when we do that, we can detect pelvic floor weakness early, because not everyone has symptoms. Because Eva asked, what are the first sign of prolapse? Not everyone has sign. Let's say, I give you back this picture. I'll show you back this picture. So let's say your uterus is here. After childbirth, maybe it dropped to here. When it dropped to there, you don't feel anything. You don't feel anything at all. It's like your bowel is here, your rectum is here. After childbirth, maybe it dropped here. The bladder, maybe it dropped here. You don't feel anything. You may not even have any symptoms at all. So if you have no symptoms at all, you won't know, right? So you won't do anything. But the next baby, when you give birth, then it worsen a bit more. Okay, it worsen a bit more, maybe you start have symptoms, or maybe you won't. But when women grow older, age is the problem. 40-something, 50-something onwards, it will start to go down more and more and more and more. That's why a lot of time in pelvic organ prolapse, Most of these women, they don't have very bad prolapse when they are young. The very bad prolapse only happen when they are old. So actually the prolapse happen with time. So when you're very old and your uterus is totally out, there's nothing you can do already. Pelvic floor exercise not going to help you anymore. So ultimately you need to do surgery. But if you detect it early, that means during your postnatal period, if I scan you and I know you have prolapse, immediately I ask you to go and see my physiotherapist to start doing pelvic floor exercise. You can bring it up back to the normal position. That's why early detection is very important. You will realize that I always emphasize early detection and prevention. It's always early detection and prevention is better than wait until the symptom occur and then maybe it's too bad and then there's nothing we can do except to do surgery. So you see, we don't want surgery, right? So early detection and prevention is very important. So that's why after give birth, everybody do pelvic floor exercise. And at postnatal, we assess and see whether there's prolapse. If there's prolapse, then only you see the physiotherapist because you may need more intensive pelvic floor exercise. So if only when we cannot solve your problem and you're symptomatic, you also need to understand prolapse is something that you don't die from, okay? That's not life-threatening. So if you have any symptom and if it's not life-threatening, you can of course also ignore it. But if it's disturbing your life, like in this case, it's disturbing her sexual intercourse, of course you need to do something. So if pelvic floor exercise does not help, then last resort is to do a surgery to repair everything. That's all for today, short and sweet. Okay, if you want to know more, please go back to my old videos on uterus prolapse, okay? So if you have any more questions, you can either privately message me or just put it in the comment section. That's all for today. See you again next week, same day, same time. Bye bye.